Assalamu alaikum, I'm Dr. Tahira and you're watching Health is Wealth on PTV World. Almost everybody out there is suffering from back pain, shoulder pain, knee pain, stiffness, and we just don't know what to do. We keep popping pills and we keep running for surgery and replacement. But there is a treatment that is there and available for everybody to actually go out and practice, and that is physiotherapy. Today we are present with Dr. Arsalan Physiotherapist, who is a doctor of physical therapy and who has specialized in orthopedics. And we are going to meet him and talk about everything that you need to know about physical therapy and how it's going to help you increase your range of motion and fight disability forever. So, Assalamu alaikum, Dr. Arsalan, we welcome you to our show. So, let's start with first things first. We are a nation that is addicted to phones and on the laptop all the time. And they're actually saying there's a condition called tech neck now, because of which people have like stiffness in their neck, in their shoulders. So, as a doctor of physiotherapy, what do you have to tell them out there for all these people who are constantly on their phone or their computers, students, everybody else? And they, there's a tendency in our society that we love popping pills instead of actually going for the root cause and for treating it. So what do you have to say about it?
So thank you very much for having me at your show, and you have put a very good question in front of me, that what about the pills and what is the remedy, actual remedy for all these kind of tech neck and what you have said. So the thing is that over the period of time, due to the overusage of phones and everything, and sitting in a bad posture. So I've talked about bad posture and good posture for a very long time now. So I'm a very serious advocate of keeping your posture upright, because technically, if your posture is not right and you're constantly working for like 8 to 9 hours a day and sitting in a posture which is like this, like your shoulders are rounded, your neck is a little forward headed, and you are having kyphosis on your back. So it will lead to a problem which is known as poor posture, and it will lead to a problem which is known as thoracic.
So what is the ideal posture? For example, do you have to stay aligned? You have to fit yourself at the end of the chair, keep your spine straight, your neck straight, your shoulders backwards, and that is how we are supposed to walk as well? Do you advocate this kind of posture? And why is it that we have a tendency to crouch all the time?
Because the thing is that this posture, like sitting like this, is very comfortable for people.
Right.
Sitting upright is a little difficult. Plus, over the period of time, when we do not go for the exercise, we do not go for the gym, we do not do any sort of, walk or something like that. So it will ultimately lead you to a fatigued and, lethargic state of mind and lethargic state of your body. So when we do, we basically stop doing those exercises and these things, so it will lead you to formation of like this. Then
so
it
your
will
entire curvature is affected.
Exactly. Plus, this is if I am sitting like this, it is very easy to sit like this, yes. But it is affecting in a longer run. It will affect your overall complete spine, your body, your muscles, your joints.
So one thing is the posture, and the other thing that you had once advised, I remember from our past programs, was the shoes. How important is the shoe and the pillow and the mattress that we are using?
Yeah.
And then we'll come back to our technique and everything else.
Yes, definitely. And I remember my words that three things are very important in your life, and that is your shoe, your mattress, and your pillow. And that reel got viral because that is actually true. So three things we are talking. So first of all, we are going to talk about the shoes. So feet is the base of everything, So if you are not comfortable at your base, then your rest of the joints and rest of the body will also be affected with those things. So having a comfortable shoe is very important. Why? Because it basically removes all of your tension and all of your problems at feet. And when the feet is comfortable, there is no problem.
So how do we know which shoe is good for us? Because we go for brands, the fancier the brand, the more expensive the shoe, the better we think it is. But what is an ideal shoe? The shoes I'm wearing, I'm sure you're going to tell me, no, heels are not very good. But what is the ideal shoe? Which shoe suits what kind of population? What kind of shoes do you wear for different activities? And what do you look for in a good shoe?
So there are some categories in the shoes. Number one is, first of all, we have to see that what is the shape of your feet.
Okay.
So if your foot is like a flat feet, then you must go for arch fit shoes, and you can have insoles in your shoes.
Okay.
Number one, so for that you have to go for medicated shoes. If you are a gym goer type guy,
Or a sports person,
yeah,
athlete.
sports person, yeah, an athlete or a runner, then you have to go for runner shoes, which are of Nike and Adidas, you know, the big brands, but they are very comfortable. So they are proper running shoes. So we should wear those kind of shoes when we are doing those activities. But those shoes cannot be worn for like complete day.
Okay.
Very less time, very specific for the running or the exercise, and that's it. So and the third type is for those people who have diabetes or neuropathy. So they have to wear diabetic foot shoes type thing, in which there is a memory foam. So these are the
So
categories.
the shoe adjusts itself according to your foot, and then you don't get all sorts of cuts and grazes and bruises on
Exactly.
it. Right? What about the heel shoes? Do you advise women to wear these heels, especially during pregnancy or for long-standing hours? Is it okay or is it not advised?
The thing is that when you wear your heels, heel changes your base of support, center of gravity also. So when your center of gravity is changed, like when you are, if you think that I'm standing, so when I'm standing like this on my feet and it's a normal shoe, then definitely my center of gravity is on the optimum level which it should be.
Right.
But when you are wearing heels, so my feet will be like this.
Or you're on your tiptoes.
Exactly.
Yeah.
So my complete body will be adjusting itself to not fall.
So the curvature is abnormal.
Exactly. The
Okay.
curvature definitely. Then your pelvis will be on the anterior side. It
Okay.
will be called as anterior pelvic tilt. So if you constantly wear heels, it will ultimately lead you to a condition which is known as anterior pelvic tilt, which
Oh my
should be
God.
treated then.
Really, that is scary. What about these mattresses that people keep marketing? You see big billboards with the best actresses on there, and it says orthostatic mattress and whatsoever. So which mattress is actually good for you? Orthotic mattress.
It is a
actually.
very good question, because every now and then every patient asks me, and simple answer is you have to be in the middle of everything, you know. So not for the for too high things, too high brands, and you should not go for the you know, bilkul low level brands. So you have to go in the middle of the things, not so stuffed or strict kind of mattress,
So not too hard,
or not too hard,
soft.
not too soft, and खास तौर पे the spring mattress.
So you should not go for a spring mattress. They, you know, they keep selling these spring mattresses for a more higher price, and we think that they are better. But I think it's the Goldilocks approach.
They
It's neither too soft, neither
try
too
to
hard.
they basically try to sell you the comfort.
Right.
In that they think that there is more comfort in that, but that is
So
not
a
the case.
foam mattress is something that is ideal.
Exactly.
And what about the base of the bed? Should it be a hard board, or should it be like a spring, or should it be?
No,
those-
it should be a hard board.
It should be a
It
hard
should be
board.
a
And the
hard board.
pillow. How should the pillow be aligned? Should we
So-
have a higher pillow,
No,
a lower
no,
pillow?
no. So basically, I'll tell you, if you will be having a high pillow, it will stretch your muscles.
Okay.
It will basically stretch like this. So muscle, if the muscle's length is like this, it will stretch it like this for on the side which you are lying on, and on the other side it will contract the muscle. So this is not the ideal case, because your spine should be aligned on the bed when you sleep. So you should be having a pillow which is like, it should be having like this much width
Okay.
or height. Like if you put your index finger on this earlobe and your thumb on the clavicle bone or the beauty bone, and the distance it gives you, that is the distance in which your height should be.
So you should remember that nothing should be too soft or too hard. It
No.
should always be in the middle.
Exactly.
Now we spoke a lot about the ideal shoe, the ideal mattress, the ideal posture. But what if somebody already started developing this kind of shoulder pain, neck pain, and all these pains, especially backache? Our whole population suffers from backache, especially the women. As soon as they cross 30, they start developing backache. And then, as we talked earlier, they keep taking painkillers and damaging their kidneys and their liver. Why don't they have an idea that physiotherapy can actually help them? How many sessions are required, and is it a continuous process?
So basically the thing is that there are two aspects of this question, and first of all, why back pain happens and why after 30s. Number one, as I have already told you, that the exercises are very important for everybody in our life. Why after 30? Because before 30 we usually go for badminton playing, for swimming, for gym, for anything like this, for exercise, for walk. But as we turn 30, the amount of stress on ourselves, the work stress, the family life stress, all these stresses basically lead us not to go for these things.
Exactly.
And we are constantly and secondly, the prevailing conditions of the country also lead us to do more than one job or two jobs. So in that kind of money making and that meet both ends, we totally forget to give ourselves time.
Exactly.
And then we start developing the muscle spasms.
Right.
Why? Because our body is meant to, as in the prayer, if we go for the prayer for the 5 times, because every body muscle is being stretched in that. So our body is meant to be moving, exercising, and sort of like this.
So basically, we are an animal made or designed by God to be in constant motion. That is why He advised us to actually be in prayer as well.
Exactly.
And we tend to ignore that. We have these stationary habits and
Exactly.
sedentary lifestyle.
Exactly.
So how much exercise is ideal, and what kind of specific exercises would you advise to people who suffer from backache? Like, are there specific exercises? Because people, they just go to the gym and they'll start stretching themselves and stretch it even more and start hurting.
Basically, there are very simple exercises which are very centric to your problem.
Okay.
So if you are having neck pain, so the kind of exercises which I give to my patients are very centric to the centric and specific to the muscle. So I know when I make a diagnosis and I make a prescription, so I write all of these things, that which muscle is actually deactivated, or which muscle is in spasm, or which muscle is basically aching, due to which you are having pain. So let's suppose if this is your muscle, this is known as trapezius muscle, this is known as sternocleidomastoid muscle. So now I will first of all do some motions or do some activities through which I can understand that these kind of which muscle is triggered. Then I'll tell them exactly which exercise we have to do.
Alright.
Like, so if the trapezius muscle is tight, so I'll simply tell them to stretch their neck like this,
Okay.
or like this. Okay, so basically the exercises which you give are very centric and specific to your problem.
Okay, so
And
people often think that physical therapy comprises of some sort of massage, and they start confusing you with a masseur. Can you please specify and tell them that physical therapy or physical rehabilitation involves a TENS machine or some kind of machine or devices like we have one here, and massage, as well as dry needling, as well as everything else along with these exercises that you specify? First, identifying the muscle. That is why it is important to go to a physiotherapist, so he can identify which muscle is in spasm.
exactly.
Yeah.
So basically, the difference between a masseur or the massage therapist or a physical therapist is very clear. The physical therapy is a complete 5 years degree program which enables us to write even the doctor name with us, and we are prescribing the actual treatments, actual diagnosing the problems. Even we help in the medical field, in the medical fraternity equally.
Right.
Regarding the muscular problems or the neuromuscular issues. Whereas a massage therapist or a masseur is simply a person who gives you a therapeutic massage,
Exactly.
in which he will use some oil or some different kind of creams or something like that, and it will be a relaxing or soothing type of an experience for like just an hour or so, and that's it.
That's it.
But that is not a treatment.
Exactly.
Comparing physiotherapy with massage is just like comparing a rock with a giant mountain.
Yes, it
So-
was very important for us to actually let our audience know the difference, because people definitely don't know the difference and they confuse, and then they go to people who are not even licensed to do physiotherapy. And why I'm saying this is because physical therapy has a big role in rehabilitation after an injury or an accident or a stroke. So much of our population remains disabled on the wheelchair, or even on the bed.
If
So
you
can
want
we-
to, if you want to know the importance of physiotherapy, you should have a conversation with an orthopedic surgeon who is a good practicing doctor, and he does the surgery.
Right.
He will tell you the importance of physiotherapy in surgeries even.
Exactly.
If there is if there is not a good physiotherapist available after the surgery, then that surgery is failed surgery.
You're so right. So let's talking about surgery. If we talk about knee replacements, since a lot of our population suffers from knee problems,
Yes.
they're going for knee replacements right before physical therapy, and they're not taking that prescribed 3-month physical therapy before and then after that will actually enable for that surgery to move. So could you shed light on this? Who is a candidate for physical therapy and who is a candidate for
Very
surgery?
great question. The thing is that we have to understand that so there are 4 grades of knee osteoarthritis for which people are doing this kind of. So grade 1 and grade 2 are the optimal grades for physiotherapy, because the problem just starts, it has just started, the problem has just started, and it is leading to the worst condition. The cartilage between the knee joints is diminishing slowly and gradually. So if we do the proper exercises for the muscles of these quadriceps and hamstrings and
Right.
all these muscles which are surrounding the knee joint, if we totally make them strength and worthy enough, so they will basically
Hold it on,
hold it on
to it.
exactly, or share the load of the knee joint.
Yes.
So grade 1 and grade 2 is the best optimal time for the, or grade 2.5. Grade 3 and 4 is optimal for the surgery. But a lot of patients are scared of the surgery and they do not want to get it, or they are old enough now to not get it. So in that case scenario, even then we take the patient, but we tell the patient that it will be a long journey for them, and it will be a long process, and plus it will be a maintenance mode.
But
We cannot
yeah.
cure that.
But to be an adjuvant along with therapy, along with the surgery, it's always going to help you, right?
Exactly.
And could you please shed light also on the fact that whether it is good climbing stairs is good for your knees, or walking or running is good for your knees, or should you be wearing a knee brace? What are the kind of activities that are actually advised for patients with knees, or is that stationary biking or cycling good for your knees?
So again, it depends on the grade, but generally what happens is that you should. So there are some tips. Number 1 tip is that whenever you sit, you should sit on a place where the height of the chair, it should be more than 90 degrees,
Okay.
so that you can easily get up and easily get down. Second of all is that when you are going down the hill or going down the stairs, then you have to place your good leg on the first side and then on the bad leg on the second time. Number 3 is that you should wear a brace, but you should wear the brace when you are moving or you are doing some work.
Okay.
The moment you are not doing anything and you are sitting idle, you should stop. You should
Remove
put
the
it off,
brace.
remove
Okay.
or put it off, because otherwise it will weaken your muscles more.
Oh, okay. So you should not be always wearing a
No,
brace
not
or a
always.
belt or
No, no,
anything.
no.
ever.
Only when you are doing an activity or only you are doing some exercise. That's it.
Okay, what about people with these things called tennis elbow? They start having problems in their elbow, and then there are others who say we have a frozen shoulder. Especially our cricket players are always, complaining of this shoulder either displaced or this frozen shoulder. How does physiotherapy help in that?
Number 1 is that a lot of people cannot, categorize properly that whether they are going through frozen shoulder or something else. So mostly with the frozen shoulder case is that it develops first because of the trauma. If you went through any trauma, physical trauma on the shoulder, or you have diabetes, or you have gone through some jerky movement. So as you have talked about the sports people, why? Because they have a very this throwing activity. They always throw the ball or
thrust, yeah.
thrust. So there is a thrust on your shoulder. which ultimately leads you to an injury in your tendon.
Okay.
So when you are facing the tendon and you leave it untreated, it will ultimately change into frozen shoulder also.
Okay. So
So-
physiotherapy is always going to help bring back the circulation, the
Exactly.
nutrient supply,
So
the healing.
exactly. Recently, day before yesterday, I had a patient here in the clinic, and he was like, he started to get this frozen shoulder symptoms 1 month before, and then when he came to me, like his range of motion was
Yeah.
just like this. Beyond this, he was very painful. And in one session, I'll share the video with you if you want to, plug it in also. So after one session, we recorded his movements, and he went around like at least 20-25 degrees more than he came to me
So
with.
this is a very important point where you're saying that the range of motion is also increased. So the flexibility of the joint, the range of motion, the movement, the ease of movement, and the comfort with all this movement and usage of joints increases. What about disability? For example, people post-stroke, they're actually bedridden, they're disabled. Does it help physical therapy, and how soon after stroke should we start physical therapy, and for how long should we continue it so that people affected by stroke or by any other trauma or accident are able to overcome their disability and increase their movement and range of motion and mobility?
Basically, there is a concept of neuroplasticity in the brain. So whenever stroke happens, it basically occludes the blood in your brain, and all of those areas in which the blood gets pooled, it basically gets affected, and so it basically affects your one side completely. So that is known as stroke. Now what happens is that what is neuroplasticity? All those areas which are damaged, the neurons or the nerve channels there, they basically get damaged. We cannot repair them,
Right.
because once it is damaged, it is not self-healing.
Irreversible, yes.
So what neuroplasticity is, that we, through physical therapy or physical motions, we try to create new neural pathways and neural channels in the brain, so that the work which the other portion which got damaged was doing should be done by another entity or another area which we are creating now. So it is just like when you tell your kids in the early childhood that study hard and repeat the lesson. One time they read or write it, so there is a line in your brain.
Right.
When they repeat it,
It's
that line,
reinforced.
yes,
Yeah.
reinforcements,
Exactly.
and that is what we are doing.
So this reinforcement, positive reinforcement, or actually imbibing a line inside, is it helpful in patients, in children with CP? Because we have so many children with cerebral palsy and they cannot move and they cannot talk or walk or do whatsoever, and then they become a burden on the society, on their parents, and for themselves as well. They have very, very low self-esteem. So what do you advise to children, to parents of children with cerebral palsy and to other patients of either MS, multiple sclerosis, or ALS, because they also have these kind of symptoms? So how long should they be on physical therapy and all sorts of physical therapy, whether it's speech therapy, physical therapy, everything else as well?
Basically, we cannot set any deadline in these kind of cases, because these are the problems which are from your brain. So we cannot do anything about it in regard of telling the time that in this time zone, like as in back pain or knee pain or any pain, I can tell easily my patients that it will take around 7 to 10 sessions or 15 sessions maximum. But these cases are very difficult, and they require a continuation, a continued type of physical therapy, which ultimately will lead to a better and healthy life, because if you will not come to a physiotherapist, if you will not go for the physiotherapy, the improvement will be same, and there will be no improvement rather.
Okay, Dr. Saab, there's one more question that I really want to ask. For example, being a dermatologist, there are a lot of people practicing dermatology or aesthetic medicine nowadays, and they keep spoiling the cases because they really don't know what the skin is all about, and they just know how to inject. The same way, there are a lot of people who claim to be physical therapists and who are not actually physical therapists. How can going to somebody who is not licensed to do it, who is not trained to do it, who has not studied like you, harm the patient?
The thing is that if I talk about myself, so I've studied like 5 years for the DPT. Then I did masters in orthopedics for 2 years. Then I did this osteopathy
Yeah.
and chiropractic. I did it, and then I got trained from a
Yeah.
very high professional who is in Italy. So the amount of study
Number of
and the,
years,
exactly, and the amount of experience which I have now. Uh, if you go to a person who is not, who has
Yeah.
not even studied, who is not even a doctor,
Right.
who is not even a, he does not know the anatomy or physiology
Exactly.
or anything like this, what is he going to treat you?
Yeah, just rubbing it or moving
Exactly,
it is not going
exactly,
to make a difference.
exactly. So people come to me and they say that we went to some Siana or some
Yeah.
Atai type thing, the quacks basically. So there was a patient of mine. He went with his mother. His mother rather forced him to go, and that quack stood on his back and he rubbed his feet. Now these kind of things are
They're actually
nonsense
going
now.
to dislocate
Exactly.
you more.
Now my patients come to me, so there's a specified and tailor-made,
And it's custom made to
exactly,
each patient.
exactly,
Right.
custom made to each patient.
Okay, Dr. Saab, there are some new technologies out there. For example, some people are using some kind of lasers, others are using PRP or platelet-rich plasma, others are using or calling it stem cell even though it isn't stem cell. And then there are others who are doing dry needling. How would you, apply dry needling? Does it work? Is it helpful? Are all these therapies useful in conjunction along with the physical therapy exercises?
I tell my patients all the time that some cases are complex cases, and like there is a standard back pain, standard knee pain, standard neck pain or joints pain. So we know that this kind of treatment will work. Some cases are very difficult, and so PRP and all these different stem cell therapy, these are experimental therapies now.
Exactly.
They work they work different from patient to patient. Some might get magical results, some might not get anything at all. So it depends from patient to patient. Number one. Number two, dry needling. Dry needling is an excellent procedure. We do it. A lot of physical therapists are nowadays doing it, and it's a wonderful experience. It's a wonderful experience. Recently, my friend brought me a patient of his in my F7 branch, and he came to me and he was having severe muscle spasm. I did not do anything. I just manipulated him and just entered dry needles.
So it's very similar to acupuncture. And is it similar to that? Is it the pressure points, or is it just the fact that you're inducing a controlled injury so that there is more repair and more collagen and more like the principle that we use? Is it the same?
Basically, it's like this. Sorry, but I don't know what you two guys do. But for I do it, or physiotherapists do it for the muscles or tendons.
Okay.
Acupuncture is more related to joints. They insert it in the joints. Plus, acupuncture is a Chinese medicine treatment, and dry needling, in which it is very simple. We do it for the muscle release.
Okay.
So in dry needling, what we do is that we inject the needle into the muscle to enhance the blood flow.
Okay.
So the restricted blood flow should be opened up, and it should release the muscle.
Okay.
That's the whole.
So basically, you're relaxing the muscle. What about this device? What does this device do? What does a TENS machine do, for instance?
So basically,
and how important is these hot and cold compress in this? And we have different kind of balls and things that you use in physiotherapy. How important are those?
So basically, these machines are for these machines are known as electrotherapy. Electrotherapy is for reducing your pain for temporary time, so that we can further the treatment which we have to do, we can do it in a better manner. Why? Because when we have to release the muscle, if the muscle is already sore, if the muscle is already in spasm, and we do not use any sort of electrotherapy or hot fermentation, then we are going to injure the muscle more.
Okay.
So in electrotherapy, the best thing is IFC, which is known as interferential current. TENS is a superficial kind of a current which we use, but interferential current is a deep one.
Okay.
It goes deep into your muscle, inside your muscle, and then it tries to relieve your pain by releasing some kind of chemicals. Heating pad or the hot fermentation, it is used for the muscle warm up.
Okay.
So we warm the muscles up so that we can play with the muscles, and these things again are temporary, but the permanent fix is actual physiotherapy, which is done by your hands,
Okay.
your tools, or dry needling or dry cupping we do, chiropractic we do, and with strengthening program we basically actually make your back or neck
We will
stronger.
be doing some exercises. We
Exactly.
will be demonstrating them right now, where you will be demonstrating how the back pain and knee pain and all those and on a patient, so that our viewers actually get a greater idea as to how we are supposed to perform them. But before that, I would like you to talk about the role of weight. How much weight should one have? I mean, should you lose weight before you start on a physiotherapy program? Does weight or diabetes or things like that interfere with it? Like how if somebody is hypertensive or somebody has some other issues, do they interfere with your physiotherapy, and do you advise them or put them onto a gym? And also one more thing, how important is it for starting a gym? Because people start to get these pulls and tears from gym and too much of weightlifting, no warm up. So what is the advice for these people exercising in gyms out there?
Pakistan is growing now, and basically as we are third world country, so everything comes very late to us. So there are very less certified gym trainers who are actually able to coach or able to train somebody. So most of the people when go to the gym, if they do not have proper professionals, if they do not have proper coaches with them, then they might injure. Why? Because simple is this, that if your angle is not right, in the gym, if your angle is not right, you might injure, and you are not hitting exactly the same muscle which you want to hit. Like if you want to hit the bicep, if you are not hitting it properly, if you are not doing it properly with the proper your position or proper form, then you are gonna definitely injure your tendon or some sort of ligament. So for that very purpose, you have to have a proper kind of trainer or coach with you, so that he can tell you at least for a month you should subscribe to them, so that they can tell you each and every angle, form, position, and that's it. Secondly, the weight. Basically in physiotherapy treatment, it does not hinder.
Okay.
But weight overall for you is definitely
Yes.
will make effect in
But
your
people
body.
think that physiotherapy is supposed to cause weight loss. Can you specify it to them and clarify
No,
it that
no, no.
physiotherapy has nothing to do
No,
with
no,
weight
no,
loss?
no. Weight loss is totally different
Yes.
journey. It's
Yeah.
a totally different.
Because a lot of
aspect.
people confuse it and they say, oh, we had so many sessions and we didn't lose weight. So can you make it clear to them that physiotherapy is only to tend to your joints and your muscles and their efficient movement and
Exactly.
mobility, and not weight
Simple
loss?
is this, that physiotherapy improves your movement restoration,
And strength.
movement restoration, your flexibility, your mobility, your endurance. All of these things are being enhanced by physiotherapy. If you want strength, if you want weight loss, go do some exercises at home or at gym. You can go for swimming, you can go for aerobic exercises, you can go for Pilates, you can go for the yoga or sort of like this. Even yoga is not for the it's for the mental
It's more for
satisfaction,
for
yes.
meditation and
Yes,
relaxation.
exactly.
What about bending? We spoke about posture, but
Hmm.
for bending, how do you bend? Should we bend on our knees, or do we bend like this? Because it said you shouldn't be bending like this. You should always break your knees and sit down if you have
You
to.
should simply bend by bending your knees first,
Okay.
and then picking up the thing.
weight.
Otherwise, if you are gonna bend like 90 degrees,
Right.
so it is gonna affect your lumbar spine. Lumbar spine is basically the last vertebral column of the spine. So it comprises of 5 different vertebrae in which there are discs. The most common problem which happens to the patients who bend like immediately like this, or pull something very heavy
Right.
without sitting and then
Yeah.
pulling it up. So what happens to them is basically there is a disc swelling or disc bulge happens.
Okay.
When the disc bulge happens, that means that your spine is in a terrible shape now.
Okay. And what about warm-up? How important is warm-up before starting an exercise? And especially since it's so hot nowadays, a lot of people come out from the heat or from the exercise and then go right into the air conditioner, after which they have all sorts of body spasms and everything.
I recently experienced it myself.
Right.
So day before yesterday, I took a shower. My room AC was on. I came and I felt a strange feeling in my body.
Yeah.
It was like a current flowing in my body. And then I suddenly went back inside the washroom, and that's it. Why I'm telling this? Because when I experienced it myself,
Sure,
then
the
I
patients
know
do.
that
Yeah.
what patient is having. So it basically, eventually, the temperature shift or temperature change, it immediately affects on your complete body system, and it shuts down it.
Right.
It makes your body shut down and make you, faint or something like this. I have seen these kind of, as you know, this year, unfortunately in Hajj,
Yes,
how
a
many
lot of
people
people have lost their lives
is
due
left
to
their
this. Yeah.
bilkul, exactly. So why? Because they suffered from heat stroke.
So you should not be directly shifting from one place to
No.
other. It should be a very gradual change
Yes.
after cooling yourself
Yes.
down, and the same way before an exercise. So now, Dr. Arsalan, we will move to our stage where you're going to demonstrate a few exercises for us on our patients, and I hope you keep watching. Thank you.
Sure.
Okay, Dr. Arsalan, so here we have our patient lying here, and I would like you to demonstrate on our patient all the exercises that our audience can do at home for their knee pain or to strengthen their knee joint in general, and all the things that they should expect when they come over to you as a physiotherapist for knee pain before going for any invasive surgery as such.
So basically, as I told you, that there are 4 grades.
Okay.
So grade 1 and 2 is the optimum for physical therapy in the osteoarthritic patients. So in that, we are gonna strengthenize the muscles of the quadriceps, relax.
Okay.
So these are the quadricep muscles which are joining on the cap of this knee joint.
All right.
So what we are going to do is that I'm going to tell him to, so John, you have to basically, yes, exactly. So he has to relax. So he has to bend his knee on this kind of, this is the foam roller, or
Okay.
you can even use
Roller
pillow
towel. Yeah.
towel or pillow at home. And then what we are going to do is that you are going to push your kneecap on the pillow or the foam roller or the towel, so that in which these muscles are getting tight.
Okay.
So when these muscles are getting tight, this is for the layman term because of the people.
Yes.
So in this, you have to do it for like 3 times a day for 10 to 15 repetitions in one set.
So in one set, we are 15 times we are pressing our knees down
For 10
on the
seconds
pillow.
hold, exactly.
For 10 seconds hold, and this is
Yes.
3 times a day.
Exactly.
All right. So what else do we do? How do we place it between them, between the knees as well?
Exactly. So the second exercise is known as VMOs. So you have to bend your knee for like this around 90 degrees,
Okay.
and then you are gonna place the pillow or the towel in between these, and then you have to basically press it
Together.
towards together
Okay.
or towards each other, so that these muscles should also get tightened up, or it should get strengthened up. You have to do this again on the same level which we have already discussed. So 15 times in one set, and 3 sets in a day, and for 10 seconds of
So
hold.
this is while lying down, or can they do it while they're sitting in their seat in their office chair? Can they also press something between their knees, sitting on a 90
Yeah,
degrees angle?
definitely. They can also, most of the people are having sofas in their offices, and on their small cushions, they can also use that while sitting. Or they can also do one more thing which is very easy for them. So you should sit.
Okay.
So while sitting, what is he gonna do is that he's gonna raise this leg, and he will try to raise it completely up
Okay.
by locking the hip.
Okay.
And plus he's gonna do like this.
All right.
So the foot will be on the
So
the
he's
inner side. Yes, exactly. Bring your foot towards your chest and do like this.
Okay. So he's raising his leg. Now, what is
Exactly.
good for ankles? Because a lot of people have ankle swelling, and then the whole when they're taking they're traveling for a long time, air travel and everything. So, what are the exercises that you would advise to somebody who's on a long flight, or, for example, if they're on a long journey, whether in
First of all, the thing is that if you are talking about the osteoarthritis, you have to constantly move your leg in the flight or on a journey which you are going on. So you are constantly you're gonna do like this, relax, yes, again like this. You're constantly gonna do like this, completely for a complete journey. Why? So that the muscles should not get stiff.
and the circulation is better.
Exactly.
And do we rotate it as well, or just up
Yeah,
and
we
up?
can rotate it.
We have
And the swelling which you are talking about is for that very reason. The best part is to do the icing
okay.
for like 10 minutes or 15 minutes, like ankle sprain and ankle sprain. But so most of the people get swelling over here.
Okay.
So you have to put like ice or ice packs over here so that the all of the swelling should go down because of the vasoconstriction or the basically we freeze the blood flow, and brain gives a signal that stop the blood flow going on.
So what would you demonstrate on him for the neck stiffness, for neck and for back?
Okay, so
Yes.
kindly sit down. So most of the people sit in the offices for like 8 to 9 hours.
Yes.
And so they do like this. They do like this work, and they stretch their arms and do the work like this, and forward head posture like this, which we have discussed. So what we are going to do is that we have to keep our postures upright by tucking your chin in and lifting your chest up, pulling your shoulders a little on the back side,
Okay.
and like this. So
Alright.
this is the actual thing
Ideal
which we have to
posture.
do. Yes, exactly. So number one. Number two, what they can do is that they can bring this hand, or the affected side, bring this hand on the back side of their back, plus this hand
Okay.
on the head, and they can like
Okay. One side
Yes.
first, and then the
Exactly.
other side.
like
Okay.
this on the second other side also.
The other side as well. And how many times do they repeat this?
Same.
Okay. So they repeat this like 10 to 15 times, and they
Exactly.
do it each
And-
time they hold
and-
it for 10 seconds.
Yes, and the
And-
tip of the trick is that you have to hold it for like 10 seconds.
10 seconds.
So
Okay.
that the stretch should be maintained.
Okay.
Otherwise, it is of no use then.
Okay, can you demonstrate it once more, just so that it's very easy for everybody? So you do this, and then you do it on that side, and then you
Your
do the
fingers
same
of
thing.
this hand should be on your
Okay.
this
So you
ear.
can do it easily sitting at work. If somebody is feeling this way,
Exactly.
they can do it easily. What about the back? What do they do for the back? How do they stretch the back?
So for the back pain, first of all, most of the cases which I see is for the straightening of lumbar spine,
Okay.
in which the muscles are so much in spasm that they pull the spine on the back side of your body. So if you lie down, please, on your prone lying. So now, in this case, what we are going to do is that, so he's going to put his hands to his chest.
Okay.
Please put your hands to your chest. Yes, like this on this side, like this. And then he's going to try to lift him up.
Okay.
But again, there's a point here that your hips should not get up.
Okay.
You are not here for the
It's
push-ups.
like a dolphin pose.
Exactly.
Okay.
Or generally people call it a cobra pose.
Oh, it's a cobra. Okay.
Yes, a
Okay.
cobra pose, it is most commonly used in the yoga.
Okay.
So like this is what will happen in this, that we are trying to create a space over here and trying to send the disc bulge or the fluid inside back.
Okay.
So this is known as a Mackenzie extension process in our field or in
And how many
physiotherapy.
times do you repeat this for back
10
pain?
to 15 times.
10 to 15
Yes,
times.
exactly.
So if we do all these three things, the ankle thing and the knee thing and the back thing every day, so it's good for our overall strengthening of our
Exactly.
joints. Thank you so much, Dr. Arsalan, for being with us today and explaining to us everything in detail.
You're welcome.
Thank you. So today we had Dr. Arsalan, Doctor of Physical Therapy at Leading Edge with us, and he explained to all of us in great detail what physical therapy is, how it's going to help us in rehabilitation, increasing our range of motion, increasing our flexibility, and decreasing all sorts of joint aches and pains. So next time you have any sort of problem before popping the pill, please actually go and consult a proper physiotherapist. Thank you so much for watching us at Health is Wealth on every Sunday, and inshallah next week we'll be meeting you soon.